Mickey Jakeni. Mr. Jakeni, good morning to you. And this has been an issue for quite some time now. The obvious question, though, is why was there such an issue getting 600 nurses into the system when we so desperately needed them? What do you think happened?
Yes, thank you, and good morning to viewers. I think our view on this matter is about the inefficiencies that have been happening in the department. It's the inability to plan on time, because when you take people on contract, surely your system should be operated in such a way that it can remind you when those contracts are about to lapse, so that you can do whatever is necessary, either for getting the new contracts to be signed, or you terminate the contract well in advance. So in this case, I think it's about what we have been reporting all along about the Department of the Eastern Cape. But we are so glad that the Premier was proactive this time around, and he has informed the department to do whatever is necessary to can retain those nurses after we have intervened as Nehawu, because we had to call the head of the department, that is acting Dr. I just forget the name, but what has happened is that after we have spoken, she gave us an assurance that they are doing everything and they will have to investigate what has happened. And we are glad that those nurses, at least now, they've got a reprieve after our own intervention as Nehawu.
Well, I'm sure it's also very important, isn't it, Mr. Jakeni, that these nurses and these healthcare workers are now in the system, considering what is happening with COVID-19. How much of a difference on the ground? Just help me understand the scale here, if you could, from Nehawu's perspective. How much of a difference does these 600 additional healthcare workers mean to the healthcare system in your province?
It has immensely added some value to what has been the challenge in the Eastern Cape, because the 600 nurses have been out there. Hence, you can see now the drop in terms of infection, because with the new variant, numbers have been increasing in the Eastern Cape, and they have done everything in their power to lower the curve. So we cannot afford to see 600 nurses going away. And we are so sure that, indeed, with this intervention, those nurses, even if their status was of a temporal nature, they will be permanently employed. And we will make it a point that we don't leave them in that status any longer.
Just a final question to you, Mr. Jakeni. Obviously good news, 600 new healthcare workers into the system, first-hand experience helping with COVID-19. Final question to you I want to ask is this enough? Have you now got enough healthcare workers to stay on top of COVID-19, or do you still believe that there is a need for more professionals?
As you know, the Eastern Cape of its rural nature, we cannot have enough nurses and doctors, because we all know that the staff complement in our hospital is very low, and we need more nurses and doctors. We have seen one of the districts that does not want to heed the call by the Premier to reinstate those nurses, the Amaton. We'll follow that up, and we'll make sure that they do what has been instructed by the Premier. And we want to call upon the government to ask for more money so that we can get as more professionals who can add more value to our quest to make sure that we improve the health services in the province.
Well, I appreciate your time in speaking to us this morning. Nehawu's Mickey Jakeni. Plenty more news for you here in a moment on ENCA.